My name's Dr Donna Lecky. I head the Primary Care and Interventions Unit at UK Health Security Agency. I lead both the Target and the Antibiotics Programme and the eBug Programme of work, and I also hold lectureship positions at Cardiff University and Imperial College London. We all have a role to play in tackling antimicrobial resistance, and for the next 20 minutes I want to share with you interventions that focus on educating the public about antibiotic use and antimicrobial stewardship. The two key groups of the public that I will focus on today are patients, members of the public who are ill and perhaps expecting or demanding antibiotics, whether they're necessary or not, and young people, the antibiotic users and prescribers of the future. What I want to go through today is identify why it is important to educate patients and young people about antibiotics and antimicrobial resistance, and then provide you with an overview of two programmes of work, the Target Antibiotic Programmes that can be used to educate patients, and the International eBug Programme for children and young people, and how it can be adapted to suit different learning needs. Here's some pre-suggested reading, specifically links to the eBug and the Target websites that I'm going to talk about a little bit later, and then some reading on public attitudes and behaviours towards antibiotic use. Why do we need to focus on patient education? It's widely documented that there is perceived demand for antibiotics from patients. And even if a member of the public would not normally expect antibiotics, when faced with uncertainty or when they become patients, this attitude can change. A public survey carried out by the Primary Care and Interventions Unit between 2019 and 2022 during the COVID pandemic showed a significant increase in patient expectation for antibiotics. So those who would not normally expect antibiotics expected them during the pandemic. The same survey showed that some patients do not necessarily finish their course of antibiotics as recommended, or maybe even keep antibiotics for future illnesses. In 2024, moving forward to today, patients now have wider access to healthcare than ever before. Lots of access to digital healthcare as well, and therefore wider access to antibiotics than ever before. Therefore, it is extremely important that we educate patients on prudent antibiotic use. Before we talk about interventions for the public, we should really look at public attitudes and behaviours to antibiotics. I'm not going to go into this in a lot of detail, but I want to show you some of the data from our most recent survey that was carried out in 2023. Of the 5,390 participants surveyed, 74% reported having a respiratory tract infection in the last 12 months, with the most common symptoms being a cough or cold. As you can see from the graph, most rank the severity of these symptoms as mild to moderate. Yet despite this, and although over half self-managed their symptoms, 41% still consulted a healthcare professional about their respiratory tract infections. And symptom severity also played a role on the course of action people take. And also should point out that those who suffered from severe symptoms were also more likely to consult. Closer examination of the healthcare professionals that people sought out during their illness, we see the reason for visiting the healthcare professional was to receive advice and/or treatment, and also because they were worried about their illness. What is also interesting from the survey is that patients overwhelmingly trust their healthcare professional. So we have an opportunity here to educate patients on their role in preventing antimicrobial resistance through prudent antibiotic use. And that takes us on now to the intervention. So as I said, the two interventions that I want to cover today are Target Antibiotics, which is interventions to improve the management of common infections for patients and healthcare professionals, and eBug, which is an intervention to improve the management of common infections for children and communities. The Target Toolkit is hosted on the Royal College of General Practitioner website and led by UK Health Security Agency. But it's important to point out it is completely available to all. You do not need to be a member of the Royal College of General Practitioners to access these resources. Target stands for Treat Antibiotics Responsibly, Guidance, Education and Tools, and it has been available since 2012, and we're aware that it's been widely used by prescribers. The toolkit is divided into 10 different sections, and I'm not going to go through all of these in detail. I'm only going to focus on the tools that healthcare professionals can use to educate the public. So key points within the toolkit for patient education. From previous research, we identified that although many healthcare professionals identify as educators, they're uncertain as to how to structure these discussions. Therefore, we'll cover healthcare professional education in training materials. We also have patient information leaflets and materials for waiting rooms as well. It's important to point out that all of the tools within the Target Toolkit are based and developed based on the COM-B model, which suggests that if you provide an individual with the capability, the motivation and opportunity to change behaviour, that can facilitate behaviour change. And the behaviour that we're looking at is responsible antibiotic use. A study carried out with the clinical commissioning groups in 2020, now known as Integrated Care Boards or ICBs, showed public and patient pressures and consultation was the biggest perceived barrier to prescribing in terms of antimicrobial stewardship. So within this section of the Target Toolkit, the Discussing Antibiotics with Patients section, there are lots of resources to help prescriber discuss the use of antibiotics with patients, including webinars and presentations that you can see on the screen now. Webinars and presentations in this section focus on putting shared decision making into practice and why and how to use backup and delayed prescribing in primary care. Each section of the Target Toolkit will have a table of contents on the right of the screen, which links to more information and resources on that topic. These additional pages go into more detail on how to find the right words using the CHESTS acronym developed by Oxford University, discussing backup, delayed antibiotic prescriptions and the important ways of capturing data in these prescriptions, and evidence to show why discussing antibiotics with patients can lead to a reduction in prescribing, improve patient understanding and improve patient satisfaction. There are also posters available for you to print within your surgeries as a prompt for patient discussions. The other Target training materials that we have is the Target Workshop. This workshop has been designed to be used with healthcare professionals in a general practice setting. It comprises a core set of slides highlighting what antimicrobial resistance is and why it is important to healthcare professionals. And then a series of clinical scenarios that can be slotted in. The clinical scenarios that we have cover urinary tract infections, otitis media, rhinosinusitis, acute cough, skin infections, amongst others. The key thing about these clinical scenarios is it also provides information on how you can educate the patient within one of these clinical consultations. And then finally, we've got core slides on action planning. So through this training, we provide that education to the healthcare professional on how to facilitate those conversations with patients. We're very aware that individuals have different learning styles and needs, and due to time and capacity may not be able to attend a workshop. Therefore, we have a suite of training tools available in different styles for healthcare professionals. These include webinar series of quarterly live webinars on key topics requested by the healthcare professional, and we always have a panel of experts on these webinars with Q&A sessions. We also have Future Learn courses, e-modules developed in collaboration with Royal College of General Practitioners, and also podcasts around antibiotics and specifically recurrent urinary tract infections. Moving on to the leaflets to discuss with patients, the Target Toolkit has a range of leaflets to discuss with patients that will support advice giving, addressing patient concerns, and research has also shown that these can improve patient satisfaction and understanding while also empowering patients to manage their infections. The other key thing about these patient information leaflets is that they standardise the advice that's given to patients. I'll run through a couple of examples of the leaflets that are available, but I would recommend you exploring these in more detail after the session. This is an example of one of the Target leaflets focusing on respiratory tract infections that can support the discussion with patients. And as you can see, the leaflet is broken down into different sections. The Most Are Better section educates patients about when to consult and how long a condition may last. Self-care section provides that key information on things that you can do as an individual at home to look after your condition. There's an area here with key information. As you can see on this particular leaflet, we had key information about the COVID-19 pandemic at the time, but we can use this to put in any key information that we need. We've got a safety netting area which supports the healthcare professional when talking about whether or not antibiotics are needed. We've got a section discussing backup prescriptions and when you may want to start using your delayed or backup prescription, and then also information about antibiotics and resistance. Here's just examples of some of the other leaflets. We've got one on treating your infection, urinary tract infections. We've got a urinary tract infection leaflet for older adults, and leaflets to discuss with patients around managing common infections. All of our leaflets are translated into think at this stage it's 27 different languages, and they're all available on the Target website to download. Following the COVID pandemic, we've had an increase in remote consultations, and as such, we've had to expand access to these patient information leaflets. So on the orange corner here, you can see that the leaflets are freely available in PDF on the Target website. They're all in accessible format, and all the latest updates will be available on the website. But because of remote consultation, we've also made them available in HTML format. Again, this makes them more accessible to a wider patient group, and so they can be shared on smart devices. They're also linked to the GP record, and an easy access link to the GP record. And they're also coded, SNOMED codes that will go into the patient record. And finally, they're available on Accurix text messaging systems, so it's quick and easy to facilitate that sharing with the patient. So even during a remote consultation, a text message can be sent and they can be discussed with the patient. Evidence suggests that if an individual receives information from 3 different sources, then they're more likely to retain that information. General practice waiting areas can be ideal places to provide key information to patients. Target hosts a range of materials for these areas, such as posters and animations. But it's really important that these materials be regularly rotated to prevent patient desensitization. Interviews with patients in GP waiting areas found that 91% of patients remembered seeing key messages from these animations that you can see in the bottom. And 47 to 55% of patients remembered the key messages. And significant positive differences were observed for questions related to intended antibiotic-related behaviours. These are just 2 examples of posters that can be used alongside videos in waiting areas or consultation rooms. In addition to the Target resources available to prescribers, the toolkit also has resources for community pharmacy that help promote consistency between prescribers and dispensers on key messages around antimicrobial use. I'm not going into detail on this, but to summarise, the pharmacy resources contain an antibiotic checklist and adapted leaflet for management of common infections. This is just an example of the leaflet for the pharmacy setting. We also have the antibiotic checklist that I've just mentioned, and this is a flow chart that just shows when the leaflets can be used with patients. So if it's a respiratory tract infection going across the top, if it's a pharmacy consultation, you can use the leaflets with the patient, and we have QR codes linking to all of these leaflets. If it's post-GP consultation and the patient's coming to the community pharmacist, the pharmacist can use the antibiotic checklist with the patients, and again, links to leaflets that can also be shared with the patient at that point. It's really important that we provide the key messages and consistent messages across the primary care pathway. So this slide just shows you some of the areas that a patient could go to seek advice for their common infection, and the areas where Target provides resources. So if a patient is self-caring, they can access patient information leaflets. If they're going to a pharmacy consultation, we've got the patient information leaflets, antibiotic checklist, and the waiting room materials. If it's a GP consultation, we've got similar materials as well as training materials. And if a patient needs access to resources from care homes, we also have patient information leaflets, care home management tools, and training materials there. So patients receive the same key messages across the primary care pathway. And that leads us on to the next intervention, which is eBug. eBug is a health education program designed to equip children and young people with knowledge on microbes and the prevention, spread, and treatment of infection. eBug can be used by educators, whether it's in school setting, community groups, or healthcare nurses. We know that eBug has been used by a range of these groups. It was originally funded by DG Sanko of the European Commission between 2006 and 2009, and since 2009 has been led by UK Health Security Agency or predecessor organisations. The concept behind eBug was to take a long-term approach to tackling antimicrobial resistance by ensuring that children and young people understand how to prevent infection spreading in the first place, and that they have an increased awareness of what antimicrobial resistance is and why it matters. Aligning with this is behaviour change. The resources are all aligned with the COM-B framework that I mentioned earlier. Children today are the adults of tomorrow, and by supporting them to adopt key infection prevention, control and antimicrobial stewardship behaviours from an early age, we're future-proofing the work around antimicrobial resistance. And children or young people are also an excellent conduit for messaging to parents, carers and wider communities. Our long-term vision for eBug programme is for children and young people in every community to implement their understanding on how to wash hands, prevent infections and use antimicrobials appropriately. We seek to do this by working towards 3 areas of change. We want school leavers in the UK understanding infection prevention and antimicrobial stewardship. The children and young people in targeted or harder to reach communities receive messages on infection prevention control and AMR, and that other countries include public education component within children and young people in their efforts to tackle AMR, taking the learning from the eBug programme. We have a few underlying principles that are a common thread through everything we do and guide our direction of work. Our international partners also follow these principles to ensure that across countries we achieve our objectives. First, the eBug programme supports the WHO Global Action Plan, specifically to improve awareness through effective communication, education and training. For countries who have a national action plan for antimicrobial resistance or are considering developing one, eBug can be used to support the public engagement components. Our resources are always evidence-based. We bring together experts with educators and other users to develop the eBug content. This content is also informed by research that we have conducted to understand the level of knowledge and need of potential users. Our third principle is around multi-sectorial collaboration. We can't change children and young people's behaviours without working closely with those who interact with this population group. Therefore, we engage with ministries and departments of education, local government, teachers, school nurses, and our international partners, as well as other agencies within the health sector to ensure that we have a cohesive approach to reaching children and young people. But why does infection prevention and control matter? There's a lot of information and a lot of research out there about why this is important, and I won't go into this in more detail, but we know improving hand and respiratory hygiene does reduce the spread of infections. And why use eBug to teach children and young people? eBug, as I said, utilises evidence-based models to improve behaviour and knowledge. And we want to improve education experience and school attendance in young people. By using eBug, we can potentially reduce the spread of infection in schools, families and communities. And we want to improve the use of antibiotics and reduce the rates of resistance in the community. Evidence shows that hand hygiene infection control interventions can help reduce absenteeism rates in primary schools, and there has been research carried out in schools and hand washing programmes to demonstrate that school absence can be reduced by teaching good hygiene, especially in the build-up to winter flu season. And this is where I pause talking and I want to share a video with you about the eBug learning journey. So that video succinctly shows all of the materials that are available for the school environment around eBug. And in this slide, I want to show you some of the topics that are covered. Materials covered at each stage is age appropriate and builds on learning from the previous stage. So if you look at hand hygiene here in the top of the slide, for example, it's covered in the early years foundation stage all the way up to key stage 4. In response to the change in the PHSE curriculum, we've also developed oral hygiene lessons and have recently included these in the early year resources as well. In each pack, you can see specifically how each lesson addresses the national curriculum for that stage. So you can see here, this is Key Stage 1, which links to science, PSHE, English and mathematics national curriculum across the different lesson plans, right up to Key Stage 4. Topics include more detailed learning through the key stages. So I'm going to use oral hygiene as an example. In the early years and foundation stage, we have an activity with a puppet so that children and young people can actually practice toothbrushing. As they move into key stage 1, they move to more and more observational experiments and demonstrate key learning outcomes. And then in key stage 2, this progresses to experiments where students can have hands-on experience and actually see the effects of toothbrushing. If we look at antimicrobial resistance learning outcomes from students, again you can see there's learning progression from key stage 2, where we highlight everyone has a role to play in preventing infections from spreading. Antibiotics should only be used when prescribed by a healthcare professional, all the way through to key stage 4, when we talk about differentiated antibiotics can be used to treat bacterial infections, and that some bacterial infections are becoming more increasingly difficult to treat due to antibiotic resistance. In the next section, I want to just briefly go over how to actually use the eBug packs. The first section you'll come to within the eBug packs is the teacher refresher information. We found from our learning that many teachers are not scientists by background and they want this key refresher information there. You'll move on then to individual lesson plan layout. So you can see we've got all the lessons are developed with teachers to ensure that they're suitable for classroom use. You can see where the lessons are mapped to the national curriculum. There's web links to show where they're available on site, and all lessons have been reviewed by the Association for Science Education to check for health and safety implications. When you go into the actual lesson plan, there's introductory points to help set the scene before starting the activity. Discussion points can be used at the end of the activity, and then a really handy infographic that's also available in PowerPoint format to be able to show the activity to the classroom. We then move on to various extension activities, learning consolidation, student handouts, student worksheets and teacher answer sheets as well. So there's lots of information available in the packs. Everything that's available in the hard copy packs are also available on the eBug website. And you can see here from the website on the top right-hand corner of the screen, the country that's shown at the minute is England. This is the English website. To access the resources in any other language, you just go to the drop-down and pick the country and the language that's available in that country. We also have videos of all of our resources and lesson plans to make it easy for healthcare professionals and teachers and other educators to be able to quickly glance at how to lay out the lesson plan. And this showcases the website. The resources are all available in accessible formats, so teachers can edit and use as they see fit. And this is all clearly explained in the YouTube videos as well. And I just wanted to point out, since September 2023, so the beginning of this academic year until today, which is the end of March, early April 2024, this is the access to the English sites. So in the UK, we've had over 80,000 views to the eBug website so far. The majority of these, unsurprisingly, are in London, but these were the top 10, 11 town views that we have. And then if you look at globally, again, to the English site, the majority of visits and sessions come from the UK, but we also have visits from across the world as well, and as you can see by the dots on the map. We also have developed a suite of e-learning resources through the Future Learn platform, so teacher training materials, educator training materials, and we have those for both the early year foundation stage and as teacher training as well. This one, for example, is a 3-week course that covers microbes, hand and respiratory hygiene, food hygiene and oral hygiene, and antibiotics, antibiotic resistance and self-care. And that's everything I'll tell you about the eBug resources at the minute. Here's examples of further reading. None of this would be possible, none of these resources would be possible without the work and efforts of a huge number of people. So just want to acknowledge some people and resources on this slide. Thank you.